Folks, I received a letter from Senator Tom Harkin pertaining to health care just recently, and I'd like to focus on a few fallacious points he made. Starting with this statement, you can see the letter up there. Of course, I scratched out my name and address, of course, because there's crazy liberals out there with no job who would probably be dumb enough to come to my door, which wouldn't be good for their health. But anyways, here's what Dung Heap Harkin said. Even those who have insurance can find themselves financially strapped because of medical bills. Due to coverage limitations or sky-high deductibles, health insurance can be woefully inadequate for their medical needs. A recent study of bankruptcy filings found that 62% of all bankruptcies were related to medical debt, and a majority of those who filed for bankruptcy because of medical debts actually had insurance. These are a few of the reasons why I feel so strongly that health reform legislation must be signed into law this year. Now, Dung Heap never cited what study he was referring to, but I do have some background information refuting his nonsense, and as per usual, I will have all the relevant links at the right side. Recent media reports tout a forthcoming study in the American Journal of Medicine claiming that medical bills are responsible for 60% of U.S. personal bankruptcies. Putting aside the overly generous criteria for counting a bankruptcy as quote-unquote medical, the figures reported in the study actually show that even by their criteria, medical bankruptcy is actually dropping. As Megan McArdle points out, the report's figures indicate that the number of medical bankruptcies dropped from almost 671,000 in 2001 to only 502,000 in 2007. That's a drop of over 25% in 6 years. Why then do the authors claim that medical bankruptcy is a growing problem? Well, instead of reporting, that the number of medical bankruptcies fell, they instead say the bankruptcies they count as medical are now a larger percentage of all bankruptcies. But the number of bankruptcies has fallen substantially due to a change in the bankruptcy law. It should not be surprising that when it becomes more difficult to file for bankruptcy, more of those who do really are in financial straits, and if some of those really are medical, their percentage would increase. As it happens, total bankruptcies drop by almost 50%, but medical bankruptcies drop by only 25%. This implies that the change in the bankruptcy law, which made it harder to file bankruptcies in general, affected non-medical bankruptcies more. It does not imply that the healthcare situation is causing more bankruptcies, because it isn't. A quick look at the numbers shows that even by the study's overly inclusive criteria, the prevalence of medical bankruptcy is hardly on the scale of serious health problems or even lack of insurance. The study uses two different definitions for medical bankruptcy. By the one set of criteria, there were 502,000 medical bankruptcies, or roughly one for every 600 Americans. By the other, there were 452,000 medical bankruptcies, or roughly one for every 665 Americans. These numbers are minuscule compared to the number of Americans who are not Warren Buffett, but suffer from quote-unquote one serious illness, or even to the number of Americans without health insurance. And of course, that number's up for dispute. Previous studies by the same authors, and again, like I said, I'll have the relevant links. You can check it out for yourself. I assume this is the one Dung Heap was referring to. Previous studies by the same authors have produced similar results by using highly questionable criteria. For example, a 2005 study by the same authors considered a bankruptcy to be caused by medical bills if there were more than 1,000 of medical bills in the bankruptcy, even if that was only a small percentage of debt totaling tens or even hundreds of thousands of dollars. They also included several other criteria for counting a bankruptcy as caused by medical bills, even if medical bills were less than 1,000 or not even included at all. The more recent study counts bankruptcies by both the old criteria and the new one that is only slightly less inclusive. Medical bills exceeding either 5,000 or 10% of income, or answering yes to a question asking whether medical bills were a reason for the bankruptcy, or losing at least 2 weeks of income because of illness. This means a bankruptcy would be classified as medical if a filer had $5,001 in medical bills, by $500,000 or even more in other debt. The personal bankruptcy rate was actually higher in Canada in 2006 and 2007, 0.3% for both years, than in the United States, 0.2% and 0.27%. Medical spending was only one of several contributing factors in 17% of U.S. bankruptcies. Medical debts accounted for only 12 to 13% of the total debts among American bankruptcy filers, who cited medical debt as one of their reasons for bankruptcy. As you can see, Harkin's either pulling information out of his butt or citing studies that manipulate the data and still don't convey the statistics he's touting. Here's another whopper from Tom I received via email. People will have guaranteed insurance renewal. Insurance companies will be required to renew any policy as long as the policyholder pays their premium in full. This pertains to so-called guaranteed issue laws and community rating laws, both which raise costs massively. For example, let's do community rating in car insurance. If you have a 55-year-old man who has had no moving violations in the last 10 years, and a 25-year-old man who has had 3 moving violations in the last 5 years, who do you think is going to have higher premiums? Well, the younger guy will, of course. And if you have a 55-year-old driver that's got 2 OWIs in the last 5 years and 3 speeding tickets, and a 30-year-old who has a perfectly clean driving record, in that case, the younger driver will have the lower premiums. But if we did community rating with car insurance, what are they going to do? They're going to charge everybody a lot to make up for it. It's stupid. That's like saying a 55-year-old who's been smoking 3 packs of cigarettes a day for 20 years is going to have higher premiums than a 30-year-old who doesn't smoke or drink. 35 states today impose no limits whatsoever on how much insurers can vary premiums, and 6 states allow wide variation among consumers. They do that because costs would rocket skyward if they didn't. New Hampshire and Kentucky repealed their guaranteed issue laws because premiums were increasing and insurance companies were leaving the state. Let's look at the results from some states that have community rating and guaranteed issue laws on the books. Only 5 states, Maine, Massachusetts, New Jersey, New York, and Vermont, the liberal Northeast, have Mr. Obama's proposal for guaranteed issue on the books today. New York, New Jersey, and Massachusetts have both community rating and guaranteed issue. And no surprise, they have the 3 most expensive individual insurance markets among all 50 states, with premiums roughly 2 to 3 times higher than the rest of the country. In 2007, the average annual premium in New Jersey was $5,326 for singles, and in New York, $12,254 for a family, versus the national average of $2,613 and $5,799 respectively. Obamacare would impose New York type rates nationwide. Here's Tom's last whopper. As I've said many times, currently in the U.S. we don't have a healthcare system. We have a sick care system. If you're sick, you get care. But we spend peanuts on prevention. The system and all of the incentives are focused on pills, surgery, hospitalization, and disability. Currently in the U.S., 95% of every healthcare dollar is spent on treating illnesses and conditions after they occur. Right now, approximately 75% of healthcare costs are accounted for by heart disease, diabetes, prostate cancer, breast cancer, and obesity. Hussein Obama made a similar statement saying only 4 cents out of every healthcare dollar is spent on prevention and public health. Obama cites Brookings Institution's 36-page Hamilton Project study, but don't expect to find that 4 cents number mentioned anywhere in the report. Instead, we get this sentence: no solid estimates exist on how much is currently being spent on prevention in the United States. Really? No solid estimate? Because 4 cents out of every dollar, healthcare dollar, sounds like a pretty solid estimate to us. So, community rating, guaranteed issue laws, they'll cause premiums to go through the roof. And preventative care won't work anyway, because you'd have to catch virtually every disease. You could test 100 patients if you're not catching about 10 of them at least. If it's 1 out of 100, it's just a money hole. So there you go, Tom Harkin and Barack Hussein Obama making up stats, pulling stats out of their butt. This whole healthcare reform that they're pushing along with Bacchus is an abject train wreck. Have a nice day. And don't thank me now for the info.